My name is Erica Carter, and I've been selected as one of the jurors in the case of the plaintiff Jacob Jones versus the St. Ashurst Hospital. And after reviewing the case, I've decided to side with the plaintiff Jacob Jones. The reasoning being the hospital, the nurse in particular, did not follow protocol when it came to the HIPAA laws. First, she left a message instead of requesting for the patient to call her back at his earliest convenience. She left a message with his daughter, which contained all his medical information, everything that was wrong, and did not clearly, there was no way for her to really know if who on the other end was really who they said they was. It could have been a neighbor, just a random person, and leaving that kind of sensitive information in somebody else's hand is dangerous. And there is protocol in all of this. It clearly states that when handling a sensitive information or personal information, you need to have a written document or something stating that they are allowed to leave a message with a family member if they identify themselves. And if not, then they are to request a callback. That is illegal in most states. And I'm now going to read to you from a source to what I found, and it just has basic guidelines for what the nurse should have followed. Okay. It says, under these provisions, a healthcare provider may disclose patient information, including information from mental health records, if necessary, to law enforcement family members of the patient or any persons who may reasonably be able to prevent or lessen the risk of harm. For example, if a mental health professional has a patient who has made a credible threat to inflict serious or imminent bodily harm on one or more persons, HIPAA permits the mental health professional to alert the police, a parent, or other family member, school administrators or campus police, or others who may be able to intervene to avert harm or threat. In addition to professional ethical standards, most states have laws and/or court decisions which address and in many instances require disclosure of patient information to prevent or lessen the risk of harm. Providers should consult the laws applicable to their profession in the states where they practice, as well as 42 CFR Part 2 under the federal law, governing the disclosure of substance abuse treatment records, to understand their duties and authority in situations where they have information indicating a threat of public safety. Which means that if there was no public safety or this man was not threatening to hurt himself or others, they violated that law. Because it clearly states from the Ashford Library that you are only allowed to disclose if somebody is threatening to hurt themselves or hurt others. And since they didn't have it, I'm siding with Jacob Jones. Because anybody could have heard that, and anybody could have been privy to something. And maybe even he didn't want his family to know what his condition was at the time. Many family members put it off for various reasons. And not only then could somebody just turn somebody's life upside down by leaving a message and not consulting first. It could have completely turned his daughter's, if it was his daughter's life, upside down because she didn't know how sick or anything her father could be. Well, thank you again for hearing why I chose the defendant. Goodbye.